Good evening, good afternoon, and good morning. This is the 1510th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Soma Sharma from Delhi. Let us begin the session with 1 minute silent prayer. Thank you all. All of you know that International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over, the Hindi session from 7:30 to 8:30, and from 8:30 to 9:30, we have the international session in English, and from 9:30 to 10:30, a local language session in Malayalam. All these sessions are going in a good way, and we are uploading the videos of the same on the very next day itself so that you can subscribe it without paying a penny, as well as you can share it with your friends so that we can reach homeopathy to every household in India and around the world. And this is the purpose of promoting homeopathy among public, is the purpose of this room, as well as connecting between the doctors around the world. And let me introduce the guest of the day. As you know, we are introducing a new faculty from Delhi, that is Dr. Soma Sharma. She has completed BHMS and having 12 years of practicing experience with homeopathy, and is the chief consultant at Agarwal Medical Center, Ashok Vihar, Phase 2, New Delhi. And she was the ex-SRF at CCRH headquarters, Delhi, and ex-counseling physician at Delhi University of Women's Association. And she has published some research articles in national as well as international journals available in ResearchGate. And she is a very, very well-known homeopath among North Indian doctors. And so we are introducing this Dr. Soma Sharma to this forum. We welcome Doctor, but let us see what is the subject. You all know that the prowess of homeopathy in pseudo-surgical cases. This is a very, very important and interesting subject. So we proudly welcome Dr. Soma Sharma to this forum. You can share your screen and you can go ahead with your presentation. You're already the co-host. Please unmute yourself. Just unmute. On the left extreme of your complete. You just click on the screen. Okay.
Yes, sir. Now, thank you. Good evening, everyone. Um, so, sir, am I visible?
Yes, I am. You are everything fine. You can share the screen now. You are
Yes,
visible and audible.
just
Yes.
is it clear? Yeah.
Yes, yes. Screen is the screen. You can make it full screen.
Where? Is it?
Otherwise, you can go ahead like this.
This is fine. Yeah. Okay. So, good evening, everyone. As you know, my topic is role of homeopathy in pseudo-surgical cases. So I would like to actually begin with saying that how many of us are actually feeling confident and how many of the patients, the general public trusts us. Sir, am I audible?
Yes, you are audible and visible. No.
So how many of the general public, the public at large is actually following homeopathy as a first line of treatment for getting pseudo-surgical cases treated. For example, they hardly know that adenoids, tonsillitis, or be it fibroids, or fistula in ano, which I'll be covering in a case also. So these kind of cases are very well treatable by homeopathy, and Hahnemann mentions about this in in under one-sided diseases followed by local diseases in aphorisms 185, 186, 187, and so on, wherein he says that only those parts which are morbidly affected, thinking that, and the rest of the organism remains unaffected. This is a very absurd thinking and absurd doctrine to think upon. Then he also, in aphorism 186, he clearly states about four to five uh, uh, four to five circumstances wherein he relegates surgery. But again, he says when the cause is external and there is no, there is this, for example, there is a fracture, or there is some foreign body which has just entered and it is not irritating the rest of the organism, and then it can be mechanically taken off. So for such cases, for only 4 to 5 cases, he relegates surgery. And he also says that even after the surgery, an active mechanical aid is required, wherein the closest possible constitutional remedy helps. Okay. So again, going on to aphorism 203, he again elaborates this thing that if we get the warts cauterized, or if we get such examples he gives, wherein he says that only if the local affection is removed, the rest of the disease is turned inwards, and then the mankind groans with considerable effects of prolific increasing diseases of manifestations of sora. We all know that. All right. So let's begin with my first case. Okay. Also, I would like to mention that Master Kent and in his lesser writings, as well as Master Hahnemann in his later writings, they all have said the same about pseudo-surgical cases. Okay. So let's now begin with the presentation. So I'll be actually presenting 4 cases which are pseudo-surgical and which got cured in a really good short span of time. And I have always used LM potency majorly. And in all these 4 cases, I have used that only. I'll just begin the presentation now. So the first case which is there is So, is about verrucae vulgaris, the warts, which we commonly have, and they are increasing nowadays. So, warts, touching toads causes warts. This was a very, very famous folk belief which existed in the past, like quite many centuries before. And as the toads, they have some glands which, when they erupt those glands, then they resemble the warts. So people used to think that touching a toad on the full moon's night will cause warts. Okay, so such kind of such kind of disbeliefs and false beliefs existed, and similarly, such were the folk remedies which used to exist. Okay. So also there is one thing which I found was that the medicine Chelidonium majus was the acrid juices of Chelidonium majus. They have been used in the past many centuries back as a remedy for warts. So there is a very interesting article which I found of 1992, wherein 18 the back at Hahnemann's time. So they had the scientists had observed that warts are transferable, that warts are contagious. So this was kind of a very established fact where. For example, Sir Astley Cooper had observed many cases where a surgeon was operating upon a patient of warts, and accidentally a few drops of that thing fell upon his thumbnail. The surgeon got warts. Again, in 1891 also, there was a similar, description of this one fellow called Joseph Payne, wherein he also developed warts. So again, the contagious nature was also evident from the second case where genital warts were transmitted between a couple. So, warts have been believed to be caused by all sort of things. For example, getting wet in the rain and masturbation, which they used to call as solitary habits, especially in women. And similarly, the warts were decreased. Warts were thought to decrease through rubbing the warts against a man who was an illegitimate father of some child, or prayers and rainwater, many things. And but again, the Chelidonium majus thing has been mentioned in the past to be of help. So now the progression in understanding. So the viral origin of warts was suggested as early as 1907 by Sufo, wherein he inoculated himself with a wart extract which had passed through some filter, and he actually developed warts. So then in 1949 and 1962, people found out the viral nature of warts. So we all know this, that common warts are developed by HPV types 2 and 4, then flat warts by type 3, 10, 28. So this is all theoretic. Now let me come to the case. So this was a female who came to me with warts on bilateral arms around the elbows since past year or so, and acne. Mainly, there were two complaints. So acne had been present since past 3 years. They were papulopustular and itchy and would aggravate before menses. Then the warts which were there were common warts, and they started on the left arm and gradually progressed on the right, around the right elbow. She got it electrocauterized by an AIMS doctor, and as well as by some other private practitioner as well. And but it to no avail. It came back, and further worse condition. It actually increased. So they were common warts only. Now let's come to the generals. Appetite was okay, apart from the fact that she did not feel anything. She did not feel much hunger during the first half, during for the breakfast. Thirst was fine, but she would especially feel thirsty after meals, and she wanted cold water. She desired chocolate. Her bowels, urine, all were okay. Sleep was disturbed because I'll be telling you the reason in my next slide, because of some personal issues going on with her partner, with her boyfriend. And she would feel difficulty getting into sleep, and frequent awakenings were there. Perspiration was not too much, nothing significant to mention. Thermal reaction was chilly. So mentally, actually, there had been a relationship tussle which was going on, and her partner was clingy and wanted to know each and every tiny detail of as to her, whereabouts. But patient was not actually interested, and she would feel suffocated. She would fight with him, but it did not end up it did not break the relationship. So this all had made her very flustered, and she would always think during the night as to how to get away from this relationship. See, she was working in a salon for 6 days a week from morning to night, 7 a.m., 7 p.m. in the night. Then, but again, her sympathetic nature is worth mentioning. that whenever her partner, even if she had a fight, but whenever her partner would call her, she would again go back to the same loop and help him, help the partner. And she loved getting drenched in the rain. She was emotional but did not cry easily, and replied back when insulted. And sometimes she scolds her fellow workers and subordinates. And she had elder siblings, which were obviously office going, so they did not feel the need for household chores as this lady did. Uh, in the past history, there have been just recurrent headaches for which she took homeopathic treatment 8 years back, which after which they did not occur, and measles and typhoid. Father had died of renal failure, and maternal grandfather had stroke. Treatment, she had got warts removed twice, but they led to multiplication of the warts. So, based on all of this, I gave her potassium hydrate 1 m, that is causticum. 1 m stat dose was given, and we followed up by Saclac for 30 days, but there was no change in the number of wards. They were as it is. And whenever she would get her vaccine and all done, they would increase, obviously, because of inoculation further. So I told her to not to get anything done. And so after a month's wait, I started with LM1, 100 ml solution, as to follow up after 3 weeks. So, but in those 3 weeks, what's actually increased in the numbers, and the old warts shows decreased size. Like there were a few bigger ones, they decreased in the size, but there were a couple of new warts which formed. And LM2, after the starting of LM2, warts gradually started to decrease in number. The medicine was continued till LM5, after which all the warts had disappeared. So she was followed up for a year. There was no recurrence, there was nothing. All the marks also disappeared gradually. So this is the first case. Now let's start with the second case, which is of kidney stones. Sorry, just a second. I would also because I am not having her before and after pictures, so I would like to show you the video testimonial of the patient. And
हाँ, तो मैं कुछ साल पहले बहुत सारे वार्ड्स हुए थे। इसका ट्रीटमेंट मैंने मजेरिया, एम्स और एम्स के एक डॉक्टर है, उन्होंने अपना प्राइवेट क्लिनिक खोल रखा है साउथ एक्स में, डमा सर्कल, वहां से करवाया। हर जगह पे मेरे वार्ड्स का बंद करा गया, जिसकी वजह से वो और ज्यादा होते रहे, 2 से 4, 4 से 8 ऐसे बढ़ते गए। फिर कुछ टाइम तक मैंने वहां से ट्रीटमेंट लिया, करीबन 1 साल। उसके बाद मैंने सोमा से ट्रीटमेंट लिया होम्योपैथिक। तो उस होम्योपैथिक ट्रीटमेंट के 1-1.5 महीने बाद मेरे बहुत ही सारे वार्ड्स हुए। उसके बाद 1.5-2 महीने बाद और मेडिसिन चलती रही। उसके बाद मेरे वार्ड्स सारे कंप्लीटली खत्म हो गए, जो कि अब के मार्क्स भी बहुत कम रह गए हैं। और जब ये वार्ड्स बहुत ज्यादा हो गए थे तो मैं स्ट्रेस में आ गई थी। तो सोमा ने बोला कि नहीं, तुम चिंता मत करो, मुझ पे ट्रस्ट करो, ये बड़े इजीली चले जाएंगे। और वैसा ही हुआ, 1-1.5 महीने बाद ये वार्ड्स कंप्लीटली खत्म हो गए। अब मैं बहुत खुश हूँ, थैंक्स टू सोमा, उसने मुझे इतना अच्छा ट्रीटमेंट दिया और इतनी बड़ी मुसीबत में मेरा साथ दिया, मुझे प्रॉब्लम से निकाल दिया। थैंक यू सोमा। और अब आप देख सकते हैं कि ये वार्ड्स बिल्कुल खत्म है। Thank you.
okay, so now let's come to the second case, which will be of kidney stones. So there have been a lot of studies on kidney stones. But my case was of urethral stone, basically. Okay, so the disease load is around 4 to 15%, and there has been a slight difference, slight shift in the cases in India and the Western countries, because there is a slight increase in the Western countries. The prevalence of urinary stones has increased in the Western countries. Now let's see the diet and the diet factors which are actually responsible for kidney stones. So, fluid intake is the most important factor. We all know that, directly associated. So, for each 200 ml of fluids consumed per day, there is a 13% reduction in the risk of stone formation. Okay, so this has been an established this thing theory and research. And then we come to the carbonated and sugarated and soft drinks, the sodas which are there. So they being generally popular in USA. So the more the fructose is, the more kidney stone chances are. Okay, so the finding of increased risk is because fructose increases the excretion of calcium oxalate and uric acid, so that kind of increases the production of kidney stones. Um, yeah. So there have been a lot of research wherein three large-sized cohort study were was published, where I happened to see it, where the vegetable proteins, they were not associated with the risk of kidney stones, even after all the adjustments of biases were made between the control group and this group. And the higher potassium intake due to high vegetable intake was one of the most protective factors for nephrolithiasis. Then a study in the Oxford cohort, they compared between various types of diets. Okay, there were 51,000 participants in this, aged 20 years and above, where they saw that high meat intake, vegetarian and low meat intake diets had, like, in the decreasing order. High meat intake diet followed by vegetarian and low meat intake diets had the lowest hazard ratio. And high intake of fruits is certainly helpful for the prevention of formation of kidney stones. Now let's come to the case. So this is a published case of mine on ResearchGate, IJRH thing, IJRH journal. So 33-year-old wheatish complexion male had burning pain in urethral region since past 20 days. The burning was only present during micturition, and he also had increasingly scanty, frequent ineffectual urination with constant urging to urinate and increasing weakness over the past 20 days. So this burning pain in urethra was present only during micturition. And on the day of consultation, he reported that he had passed urine nearly 18 to 20 times with intense burning pain and passage of very few drops. There was no past or family history of calculi. And since childhood, he had the other complaint was he had repeated sneezing, tendency for sneezing and running nose, and acrid nasal discharge and acrid lacrimation. Both the discharges were acrid with every change of season. About his past illness, there was a very strong feature of dog bite, as he was a dog lover, but he was poor, so he could not afford a dog. So he would always feed the street dogs and get bitten, or there would be scratches wherein there was not too much of blood, but at least the scratches were deep enough. by the stray dogs. So injury to great toe he had once, fracture of ulna a year back, that's it. But dog bite quite many number of times. His father had pulmonary TB and recovered now. He was married for 18 years, smoking 1 to 2 cigarettes a day and occasional alcohol consumption. Let's come to the physical journals. Appetite was fine. He used to feel hungry, but his irregular meal timings were there because he was a driver. Thirst was increased. Thirst already he had increased thirst of 3 to 4 liters because he would drive all day out, and but he had increased it to 8 liters since past 15 days because everybody had advised him to do that. He desired extra salt in his food and spicy food, fish, and tea. 7 to 8 cups of tea daily, which is understandable being in his profession. And perspiration was profuse even in AC, even while he was driving the car, he would feel hot, more on face and neck, and it was offensive. Then sleep was fine. Thermal reaction was hot. He could not bear sun for long. Then let's come to the mental generals. There is not much. There's not much to talk about. He belonged to a poor family, and he's fond of dogs. So okay. So his primary complaints of pain and reduced urinary output, they were, I followed this up with a scale, which was the numerical rating scale. This was in my early times, after the year I had just passed, 2013, no, 2012 or 13. So there was, we like maintained, this was taught to us during the internship, that no urine was one, passage of few drops ineffectual, flow increased, and normal. So this was rated as 1, 2, 3, and 4. So let's come to the prescription now. So he was given lysinum LM1. Why? Because there are again 3 to 4 very pathognomonic features of the case, wherein there was much craving for salt, intolerance to sun, then dog bite, history of dog bite. So these three were very, very prominent features of the case as well as of the drug. Hence lysin LM1 was started. And why did I just give LM1? Because obviously Hahnemann mentions that it is the most perfected of all potencies, and every correctly chosen homeopathic medicine, even though action is of long duration, may be repeated daily for months. Although in this case, we did not require much repetition, but still. And another thing I want to mention is that in lesser writings by Hahnemann, Hahnemann had sent 2 actual cases which were treated by himself soon before his death in April 1843. There also he mentions about giving LM potencies to his 2 patients. You can read this in lesser writings by Hahnemann. So yeah. So LM1 was started with like thrice a day, 10 strokes, 1 teaspoon in little water thrice a day. So urine flow markedly improved. Yeah, so this is of 2012 only. Urine flow markedly improved, but pain persisted. There was no nausea or vomiting. Water intake was good. There was no fever. Continued to take the same medicine. 19th July, his urine flow improved. Pain was reduced. Lysin LM2 was prescribed because 3 or 4 times a day, as he was taking his medicine, got finished in 3 days approximately. Then 21st July 2012, he reported that he has passed a stone in the morning. So when measured, it was found out to be of 11 mm. However, his ultrasound had showed a large calculus measuring 0.8 centimeter in the prostatic part of urethra. Although when we measured it, it came out to be 1.1 centimeter, that is 11 mm. So, so again, this entire pathobiography of the person matching with the presenting with the calculus, it relieved the spasm as well as the tendency to form recurrent stones in future. Yeah, very importantly, even Dr. James Tyler Kent, JT Kent, he also says that you cannot promise there will be no more colic if you only fit the condition. This also he has mentioned in his lesser writings, wherein he mentions about gallstone colic and renal calculi, both, where he says that if you prescribe only for the stone per se, then the stone will pass, but there will be more stones. So prescribe a constitutional remedy which fits the case, and that then only you will get the complete cure. There were some rubrics also, but retrospectively we looked into it. But urethral calculi, back at that time, I could not find it in any repertory, although it was not required also, but because still there were very clear indications of the medicine lysine. Next up is a case of fistula in ano, and I have found very few published cases of fistula yet in homeopathy. This is not a published case either, but a lot of cases I have found for piles, that is hemorrhoids, but few only published for fistula. So this was a female, this was recurrence. So this is a known case of fistula, came in, this is a very recent case, 3 months back. This is a case of fistula recurrence. So she came to me with severe burning pain in anal region and swelling since 1 week, high-grade fever, and along with this, she had burning pain in left leg since past 4 days. Ibugesic and Dolo every 14 hours, Dolo 650, she was taking with little relief. And after being advised to undergo surgery for the fistula by the surgeon, as she came to me to seek if there is any other solution, because she was a case of recurrence, so she knew. And even the surgeon at that point of time, wherein she went for this consultation, the surgeon said that this can recur after 2 years. The surgeons clearly say usual scenario is this, that they say that yes, this can recur. So she thought that homeopathy might provide a better alternative to this. So I'll share the reports after a few slides, but there were complex transsphincteric fistulous tracts and various pockets of pus collection, and she was in a really bad shape. There was burning pain in gluteal region. The fistula was, there was no opening. That is the major thing to notice, that there was no opening of fistula which had developed yet. And the pain was so much so that she was in screaming. There was much restlessness, high fever, anxiety, and continuous fever. The fever, I inquired I inquired with her husband and children. So they say that burning pain was radiating to whole of left leg. This obviously the patient reported, but heat stage had frequent thirst, chill stage had no thirst, and there was extreme exhaustion and restlessness. Even after the exhaustion, she would feel restless. She would feel breathlessness as well. She was again getting up from the bed. I did a video consultation. So she was completely restless for those 10 minutes. And she was covering as there was chill stage going on during my case taking. So another thing is that most of the symptoms were worse around 1 to 2 p.m. Okay. So I took her case taking, I did her case taking around 8:30 at night. And she said that since past 4 to 5 days, all the symptoms were worse around the noon time, just after noon time. Even if she took her dolo medicine at 12 noon, still the chills would come up after an hour. Okay. So otherwise, for the rest of the day, whenever she took dolo, at least the fever would go up to 102 degrees Fahrenheit, and the restlessness along with extreme exhaustion was the most distinguishing feature. So I think all of you would agree here that arsenic album 30C I gave as I could not courier the medicine right there. It was a case of Gurgaon. So she happened to have arsenic album 30C at her home. So at least I told her to start with 2 drops of arsenic album to be diluted in half a cup of water, and 1 teaspoon from this mixture to be taken every 3 hours after stirring a little. Now, this concept of stirring, where did it come from? So, I read once in Chronic Diseases by Master Hahnemann that even if you stir if a dose is being made and kept for some time, stirring before taking the next dose increases the potency a little. So, as we all know, that slight changed potency has to be given for the vital force to act, for the vital force to improve, right? So, same principle I followed until a day fever fluctuated again in the same range of 102 to 103.5 for the next few days, for the next 2 days. So 22nd July, whenever that mixture would finish, I had asked her to make a new mixture, keep it covered and take 1 teaspoonful every 3 hours. So 22nd July, 8 p.m. So exactly after 48 hours, I asked her to take arsenic 200 in the same manner. As there was not much difference reported by the patient yet. So fever and leg pain begin to subside, and fever touches 99 degree for the first time since a week without taking dolo. I asked her to stop taking dolo if it did not cross 103. So she followed this instruction, and within around 9 to 10 hours after taking the divided doses of arsenic album 200, discharge started. So that was a very promising thing for the patient as well as me, that at least when there was no opening seen previously, at least the discharge started. So discharge continued from 23rd of July to 27th of July. Fever kept on swaying between 100, sometimes 99, 100.5. And appetite was a little better, weakness was quite better, leg pain, that the pain which was burning, going through, radiating to her left leg, that also decreased. So discharge, she was using approximately 7 to 8 gauze pieces for the first 3 days, and thereby after 5 to 6 days of discharge, it completely stopped. But again, even now, our patient could not sit. Okay. But from 28th, it became status quo. There was no further improvement. The discharge had stopped. The fever was not much. The pain was there. On and off, the pain was there. And most importantly, she could not still sit. because the patient was quite anxious. We waited for 3 days, and then detailed case history was done, after which she was prescribed staph, and she's still continuing the treatment. It's been around August, September. So it's been 2.5 months, and discharge again fluctuates. So, but she's able to sit for like half an hour or so nowadays. Let's compare her reports. Actually, yeah, because why I got her MRI done very soon, that is maybe 9 to 10 days only, because she was very insistent upon getting it done. That yes, the discharge has started. Let's just also find out through MRI. How much ever I tried to convince her that don't repeat the MRI so soon, but still she got it done. So here we see that there are multiple openings. This one, okay. So complex transsphincteric fistulous tract was there, and in the other one, in the other one, um, see, they have mentioned that the evidence of collection approximately this now versus this previously. So there was in one of the pockets there of pus collection, there was decrease 0.7, 1.5 and 2.9. Now 1.3, 1.4 and 2.9. So there's a minute difference, but at least we could, after 9 days, but at least we could give little symptomatic relief to the patient. And so mild interval reduction in the size of collection, this in the fossa was reported. So now she has got some faith, and she is in no hurry to get the MRI done anytime soon. So the takeaway points are female gender, BMI more than 25, complex fistula group, higher number of tracts, anterior tract, and depending on the the previous operation which she got done, previous fistula surgery. So these all factors are reported to be causing a higher rate of fistula recurrence. And comorbidities like obesity, diabetes, these all things also can increase the risk of fistula recurrence. Several articles, as I had mentioned in the beginning, that several articles about fistula have been published about the role of homeopathy, but mostly in the past. I did not find many of them during the previous 10 years. Common remedies by the researchers have been silica, fluoric acid, causticum, and nitric acid. But so obviously these tend to reduce the discharge, manage pain, and overall condition. Now let's find out what homeopathic literature has to say about fistula in ano. So the book by J.C. Burnett on fistula and its radical cure, he clearly mentions that fistula is most commonly a constitutional affection, and therefore be treated by a physician. The local treatment is wrong, irrational, and harmful. Um, so uh, again, Hughes, and yes, J.C. Burnett gives us many examples wherein he treated the fistula with no recurrence. Then Hughes, in his Manual of Therapeutics, he mentions about two medicines, calendula and hydrastis, among others. But again, he also maintains the fact that homeopathicity of the case is the most important thing to find. Okay, now I'll be presenting the last case here, which is uterine fibroid. So you people, you doctors, respected doctors, you must have also seen that the cases of fibroids are on a sharp increase. So ever wondered why? So I came up with a few research articles wherein I saw that EDCs, that is uh, endocrine deceiving chemicals. So endocrine, so they are mostly to be, they are mostly at fault. Then obesity, vitamin D deficiency, all of these factors are contributory to uh, the development of fibroid and many other things. So these EDCs, there was a recent article also in TOI which mentioned about Yamuna River being full of EDCs and that the authorities are doing their best, but still they have not got any serious results on it. So these EDCs are actually man-made substances which mimic the function of hormones. They may, particularly estrogens, thyroid hormones, and androgens. Okay. So they modify the signals of hormones and affect the normal tissues of normal tissues and organs. So they mimic the biological activity of hormone. They bind to the receptor but do not activate it. So that gives the body a signal that yes, there is. So the natural hormone tends to be free in the circulation, and this causes an antagonistic effect. Okay. Then they bind to the transport proteins, thus altering the amount of natural hormones. So basically what the EDCs do, so these are endocrine disruptive chemicals. So they are playing with the hormones of the body. Okay. So they are causing all sorts of cancers, endometriosis, precocious puberty, and if exposed prenatally, they also affect neural function and a lot of diseases of thyroid as well. So there are particularly environmental phenols, parabens, plasticizers, and tributylin. These all have a link with fibroid also. Increased fibroid severity, phthalates, and ethylzyl. Okay, and both human and experimental studies have indicated that important role they have in fibroid pathogenesis. Yes, there is a very important thing which is that low vitamin D levels, they have an inverse correlation with the uterine fibroid volume. So larger fibroid volumes had low serum vitamin D levels and vice versa. So we should always get that checked. Then again, there is homocysteine level, which also plays a role in fibroid. That homocysteine and development of homocysteine is also a marker for heart attacks. And in one research, it was seen that folic acid and B group vitamins, if they are given to patients with fibroids, then at least they stabilize, if not increase, the size of fibroids. So, hormonal perspective, we see that estrogen has been linked majorly. Progesterone's effect is not usually much to talk about, but uh, estrogen's activity, estrogen receptor concentrations, they are also increased in uterine fibroids, okay, uterine leiomyomas. And estrogen levels in may be high due to two factors. First, because of the estrogen in circulation, and second, estrogen is also secreted by fibroid tissue, okay, by the aromatase conversion of androgens. So this increases the size of this actually acts on healthy myometrium and causes the fibroid tissue growing. Obesity again, because obesity again induces fibroids. I'll just hurry up now. I think there's less time left. And so mainly this is the hormonal aspect only. Let me get to the case straight. So there was this lady. This is a case of subserous fibroid, which is quite rare, around 10% only. And she had low appetite, pain in her ankles, spine, knees, and she had been advised hysterectomy by her gynac. Headache on exposure to cold air, and frequent gastric disturbances, flatulence, burping, and menorrhagia. So she would feel weakness and giddiness all over her body, that she would start feeling breathless and sit, could not continue the household chores, and exertion also causes pain in her whole head, which was better by tight bandaging. She'd tie the chunni and sit. There was low appetite and headache whenever she would wash her hair and go out in sun to dry, especially in winters, because she loved the cold air. But at the same time, that chilly winds, which are so much prevalent in Delhi, they would always cause her headache, and she would spend her whole day in bed. Joint pains were worse early morning, flatulence, loud burps. They would start soon after eating, and she had menorrhagia. Pain was better by warmth, and menorrhagia as well as dysmenorrhea. The pain was better by warmth. Clotted on first 2 days. The bleeding was clotted. Pain with vomiting on day one. Um, Nothing much to talk about in family history or past history. They were not relevant to the thing. Then let's come to the physical journals. That thirst was okayish, not too much. She had decreased appetite and would feel that soon after eating few bites, she would feel pain in epigastric region and substernal region. Then she had strong craving for sweets, paneer, and citrus fruits, especially oranges. Um, bowels were regular, except that she would pass out a lot of flatus and then would clear out. Sleep was unrefreshing, 7 to 8 hours, but she would not get back into sleep easily once disturbed. Thermal reaction was chilly, perspiration not offensive, whole body. So based on all of this, she was prescribed Argentum, LM1, based on all these symptoms, as you can see, and follow up. Yeah. So Argentum LM1 to LM9 were continued with the bowel symptoms and headaches and fibroids all getting cured. But it took around 7 to 8 months for all of these symptoms to gradually diminish. And there was no magical cure, obviously. And appetite also began to improve gradually. Giddiness was better. Uh, she was she continued the treatment after no, she discontinued the treatment after July 2022. Let's see her reports. So, this subserosal fibroid, it was 5 centimeter by 5 centimeter by 6 centimeter anterolateral left wall. Okay. And there was a little ascites as well. And in this one, uh, let me show you the date. Yes, so this was 17th May. There is no uh, there is no fibroid. Okay, endometrium is fine. Previously mentioned fibroid is not seen in the present scan. Hepatic steatosis, I think uh, hepatic steatosis they had not mentioned here in the first page, but I think they had mentioned on the second page. Yeah, so fibroid had completely disappeared, and because of her obesity, such hepatic steatosis just remained a bit, but she discontinued the treatment afterward. Yeah, so that's it.
Okay. Thank you, Dr. Soma Sharma, for excellent presentation of these cases. All the cases were brilliant, even though you take only few minutes for cases. That itself is the beauty of your presentation, because you are a person who has shown that the importance of case taking, as well as the finding correct rubric, and the mm, repertorization and everything is important to find the constitutional medicine. That's the reason why in the last case the Argentum worked in a beautiful way. Now, nobody never thought that the Argentum can do such wonders, but it is not the medicine, that particular any medicine that works, because since it is the constitutional medicine that comes on the way, that's the reason why you get the wonderful result with that remedy, that medicine. So anyway, congratulations for you for such a beautiful session in this evening. Hope we can have some more presentations from you in the coming months also. I
Yes.
invite the participants to for only few minutes remaining. Anyway, Dr. Manoj, you can speak for a while. Sorry, please unmute.
Yes, thank you, Ganesh, and all participants for the session. One thing in the case of AML, I think you must suspect a tubercular history or tuberculous component there. The recent writings you can see that the rectal tuberculosis, where anal fistula is the number one feature. Then also we can see or material medical often describe chest symptoms alternate with a fistula. So it's a manifestation, I think. It is written in the HR, or maybe, I'm not sure about that. In that case, I think anti-tubercular medicine may be more helpful. Anyway, nice presentation. And once again, proves that we should always stick out to the basics. That's the most important thing. Even though it's a tough job to do, wonderful presentation, nice results you got. Thank you.
And now I invite Dr. Bob Lim to say a few words, as well as Dr. Thanks to this session. Dr. Bob? Dr. Bob Lim, please unmute yourself and you can speak now.
Hello.
Yes.
Hello. I'm sorry. I am busy outside. You want me to say something?
About the presentation, as well as you can say the vote of thanks to the session also.
Yeah, that was a very good presentation by Dr. Soma. I think she has covered a lot, from the basics and into the technical details, and it's very, very highly technical tonight. And she has done a very good job. And on behalf of the IPH, I'd like to congratulate her and thanks her for her sharing tonight. And welcome her again for another session. Thank you very much. Over to you, Dr. Danesh.
Yes, thank you, Dr. Bob Lim. Dr. Soma Sharma, do you want to say anything more?
No, I think that's it.
Since we have only short of time, the discussion time must cut down. Just only 5 minutes. That since you are presenting 4 cases, that's the reason. Always we ask the presenters to limit for maximum 50 minutes. 10 minutes is reserved for discussion, like that. And that is the beauty of our
I'll keep that
sessions.
in mind for the next presentation.
Okay. Tomorrow we will have a session from Dr. Paul Joseph from Canada, and Doctor will be talking about the key of compassion in care. That will be the subject for tomorrow. That is also an interesting one. We always come with a different a special subject. That's the beauty of this Professor Paul Joseph. Anyway, thank you all for joining this session, and thank you once again, Dr. Soma Sharma, for this beautiful evening, sharing some of your knowledge with us. Thank you all. Good night. It's over to Dr. P. Shaila to moderate the Malayalam session.